So hello guys, welcome to our channel Niberian Solutions. So today we are going to discuss about the Mpsc Drug Inspector syllabus, right? Okay, so we are going to see the syllabus in very details, right? So there are different sections in the syllabus of our Mpsc DI. So these are physiology, pathophysiology, pharmacology and toxicology. That is our section first, right? So again this section first is divided in the sub four groups, right? So like physiology, pathophysiology, pharmacology and toxicology. So in physiology, composition and function of blood elements, coagulation of blood, blood groups, blood components, manufacturing, whole human blood IP, that is your Indian pharmacopoeia, then blood bank operations or the requirements. So if you see carefully, the physiology section, it includes the only one topic, that is your blood, right? So that all the points here they have covered, that is totally about the blood, right? So you have to go in detail with that specific topic of the blood, right? Then pathophysiology, the topics are sexually transmitted diseases, AIDS, hypersensitivity and HBsAg, right? So that is totally related to your hepatitis, right? So there are only four topics from your pathophysiology. Then the third section or the subsection, that is pharmacology. So the pharmacology, right? So that is very important section, right? This one, sorry. So pharmacology, right? It is starting from here, you can see, right? So pharmacology is the like highest importance, right? Please give the highest importance to the pharmacology sections, because if you are seeing the previous paper of your Mpsc drug inspector exam, I think most of the syllabus or most of the questions they have covered from your pharmacology, right? So what are the pharmacology, what are the subtopics that we are going to cover, right? So these are the factors modifying drug action, drug affecting coagulation, antihypertensive drugs, antipyretic, analgesic, antitussive, sedative, hypnotics, opioids, NSAIDs, right? Local anesthetics, chemotherapeutic agents including anti-cancer drugs, antifungal drugs, drug affecting CNS, anti-diabetic drugs, contraceptive drugs, hormones, drugs acting on uterus, right? So they have given the specific topics from pharmacology. So we have to cover that all the topics from the pharmacology, because strict to the syllabus, right, or to the point, we are going to cover that all the syllabus from all the topics, right? Then the fourth one is the toxicology, right? The classification of poison, chelating agents, heavy metals and antidotes, right? So that is our first section that include that all the syllabus. So before going to that all the study, right? So please make a strategy, like we have to cover all the syllabus first, right? So whatever the points given in the syllabus, so that points we are going to cover first, then later whatever the minor subjects that we will cover, okay? But the first aim is we have to cover the syllabus, right? Okay, so first section that is completed here. Then section second is the microbiology, right? So what is in the microbiology? There are the sterilization procedures, aseptic techniques, disinfectant, pyrogens, lal test, assay of antibiotic and vitamins. So that topic is very important. Biochemical, serological or virological techniques, biological oxygen demand, different medias, microbial drugs, drug resistance, microbial limit test, pathogenic organism of common occurrence. So that is the syllabus they have given from the microbiology, right? So among this one, like sterilization, disinfectant, lal test and that assay of antibiotic and vitamins, so these are very important topic, right? That is the second major subject that we are going to cover in your drug inspector exam, right? So first one is your pharmacology, second one is your microbiology, right? Okay, the next one, the biochemistry, chemistry of drugs and pharmaceuticals, right? So here are the different six subsections are there. So in this 3.1, that is your first section, DNA, RNA, nucleic acid components, enzymes, metabolism of protein, carbohydrate and lipids, then recombinant technology and its application, then immunological products, that is the vaccine and sera. So I think that totally related to your biochemistry, right? So already we have covered in our FDA exam, right? But in here we have to cover in the detail, very details that we are covering in your biochemistry section. Then 3.2, that is isomers, tautomers, fermentation, synthesis of antibiotics, diazo reactions, and chemistry of steroids. So please very strict or the to your syllabus, because first we have to complete our syllabus, because if you are looking the previous question papers, these are totally related to your syllabus, right? There is no question out of the syllabus and all. So that's why first cover your syllabus and then go for the another minor subjects. In the 3.3, that 3.3 section is totally related to your pharmaceutics, dosage form, sustained release dosage forms, enteric coating, new drugs, parenteral drugs, GMP, GLP, then route of administration, preservatives, suspending agent, emulsifying agents, type of vehicles used, type of waters used, then storage condition for pharmaceuticals. So if you are looking, so like these are topic related from your industrial pharmacy or dosage forms. So there are very like minor questions from the pharmaceutics, but we have to go through it, right? Whatever the important topics like suspension, emulsion, solid dosage forms, semi solid dosage forms, so whatever the important topics, definitely we are going to cover it in our DI preparation, right? Then in the 3.4, there is a principle and application of analysis, UV, IR, HPLC, GLC, then atomic absorption spectroscopy, HPTLC, LCMS, limit test, heavy metals, devices, and sutures. So that is totally related to your pharmaceutical analysis, specifically to the spectroscopy and your chromatography. Limit test is also very important from your inorganic chemistry, then heavy metals, right? So please go through your like pharmaceutical analysis. Then 3.5 is the surgical medical devices and sutures, and 3.6, that 3.6 section is related to your pharmaceutical jurisprudence, right? So totally 3.6 is your jurisprudence, that is law, DCC, drug consultative committee, then DTAB, then misbranded drugs, standard drugs, spurious drugs, adulterated drugs, right? Government analyst and their duties, drug inspector, their powers, their procedures, their duties, and then definition of schedule M, Y, and U. That is the third major topic or the major subject that we are going to cover in the our DI preparations. So please go according to your preference. First one is the your pharmacology, then your microbiology, and third one is your pharmaceutical jurisprudence. So I think these three subjects, so you are covering your 80% syllabus. Please remember these three subjects: pharmacology, microbiology, and your pharmaceutical jurisprudence. You are going to cover the 80% of your syllabus, right? So because these three major subjects, very major subjects, because in other DI exams, depending on your state and all the factors affecting it, but in Mpsc drug inspector, that pharmacology, microbiology, and jurisprudence are the major or your scoring subjects, right? So please, we have to read that subjects in very detail, right? Okay, and the last one, the general knowledge related to the pharmaceuticals and medicine field. So that is the National Health Program, DPCO, then NPPA, right? Drug Price Control Order, narcotic drugs, poison and their antidotes. Again, this is from your pharmacology, very important. Then essential drugs, that essential medicine list, right? Then Central Drug Authorities, nutraceuticals, Magic Remedies Act and rules, import of drug and cosmetics, CDL, right? WHO GMP identification, current events, Consumer Protection Act, and Right to Information Act. And what is the fifth one? That is the intelligence test, right? So if you are looking in the this all the, right, from the your pharmaceutical jurisprudence, okay, like DPCO, narcotic drugs. So means section 3.6 and the fourth, right? So this is totally related to your pharmaceutical jurisprudence, right? So that all the syllabus, so here that syllabus is completed, you have to go to all the syllabus, right? But please do or make your strategy accordingly. Please prepare your plan, and please do the pharmacology, microbiology, and pharmaceutical jurisprudence on your priority basis, and then do the like other remaining subjects like the minor subjects, right? But the pharmacology, microbiology, and your pharmaceutical jurisprudence, these are very important subjects, because the major portion, right? So whatever the questions they are asking, the major portion they are covering from your pharmacology, microbiology, and pharmaceutical jurisprudence, right? Okay, So accordingly, definitely we are preparing for our drug inspector exam also. So like syllabus wise or the subject wise, we are covering the videos one by one, right? So that all the syllabus we are trying to cover all the syllabus on our channel, right? So please keep in touch and please keep studying for your drug inspector exam. Thank you so much.